Welcome to another COVID-19 outbreak briefing. I'm Mark Polinkars, Erie County Executive. I'm joining you from the Rath Building in downtown Buffalo. Also joined by Kendra from Deaf Access Services, who will be providing the American Sign Language to those that have a hearing issue. Sorry for a little bit of delay. We were having a slight technical difficulty, but it appears to have been resolved. So thank you for joining me here today. And for those of you who witnessed the press conference I did earlier with the New York State Association of Counties, as well as County Executive Mark Molinaro from Dutchess County. There's a lot of new information I'll be talking about now than earlier, but this is your second time with me today, so I hope you don't get bored of it. As usual, we have a proviso that is presented with regards to the information that is presented is as current as when it was put into the PowerPoint presentation, generally in the last hour, or as otherwise noted in the presentation. So please, for the latest information, you can always go to our COVID-19 webpage at erie.gov/COVID-19. You have me today alone with Kendra. Dr. Burstein is off today. Wednesday is her day off, even though she's working at home on lots of phone calls. But to give you some information that we have not talked about, it's National Nurses Day. And I want to thank all of the nurses out there who are serving in all of the settings, whether they're nursing homes, hospitals, schools, home health care locations, doctor's offices, of course, our public health nurses. And you see a picture of Halise White and Jackie Andula there. Andula. They are working the front lines at our public health drive-through testing lab. So I thank Jackie and Halise for the work they're doing. There's just many of the nurses that are out there. So thank you to all the nurses on this National Nurses Day and the start of what is National Nurses Week. We certainly thank them and appreciate their great work during this entire crisis. The latest information with regards to cases, deaths, and hospitalizations. As of noon today, there were 3,923 total positive cases out of 20,734 tested. We're actually seeing a little bit of a decline in the percentage of positives compared to tested. It's not a total surprise as we test more people. Just to give you an idea, the first positive case we identified in Erie County was only 54 days ago. That was on March 14th. And then I issued my state of emergency on March 15th. So we're not that far away from what was the start of this in our own community, and we're trending up to 4,000 cases. 323 people have died, 247 since just 1 week ago, or I should say 247 was the number 1 week ago, not 247 in a week. So we have seen a sizable amount of deaths. Approximately, it looks a little bit less than about 75, I should say, in just 1 week. And these are all lab confirmed cases. There's no presumed positive cases. And as I noted, our first death was actually on March 25th, so it's been 43 days since the first death, and we now have 323 people who have unfortunately died from COVID-19 in our community. And I do offer my deepest condolences to all of the family members and friends of those who have deceased from this terrible illness. Hospital report for May 4th, we have some very good data to announce. There were 222 individuals that were hospitalized. That is down from just May 2nd, in which it was 240. Of those that are hospitalized, 97 were in the ICU unit, and 65 of those in the ICU unit had an airway assist. That is also down, so that's a very important trend factor that we're keeping a look at as it pertains to reopening of our community. This is something that has not changed since we presented it on Monday, but we'll be providing weekly updates on the positive COVID-19 tests. As you can see, it wasn't that long ago that 28%, almost 29% of the tests that were being performed were coming back positive, and the most recent week's test data shows it was about 16%. So we are seeing a decline as we're testing more people that are becoming positive with COVID-19. We will update this graph on a weekly basis, and we're hoping that trend continues, at least as it pertains to more people that we're testing in the community, and there's lots of testing going on in the community. The next chart graph shows the continued decline in hospitalizations as well as ICUs, ICU airway assists, and the bottom line is deaths. These are all numbers we have to keep track of. This is 2 weeks worth of data here, and the hospitalizations have gone down. They're not at the lowest level they have been during this past 2 week period, but they're pretty close. ICUs, we are actually at the lowest level that we've seen ICU usage during the last 2 weeks, and ICU airway assist, you see that continue to go down. We did have a spike in deaths. That's a little bit of concern because we have to, as one of our key indicators for New York State, actually keep track of that, and if we have increases in deaths during a rolling period, that could actually hurt our ability to reopen, so we're very worried about that. That would be deaths in hospitals, not all deaths, because not everybody dies in a hospital. Some people are dying in nursing homes. Most are dying in a hospital, but there are some in the nursing homes, and we've had a handful of cases, we believe, that have actually died in their home that were COVID-19 positive. So we'll keeping track of this trend. And I just want to show you with regards to hospitalizations themselves. You will note we have the data here for May 3rd, and now I'm going to show you the data for May 4th, and you do notice that drop I talked about in caseloads. And we're not seeing any age difference drops with regards to the people under the age of 44. It's still the same numbers, but we did see a drop in the 45 to 64 category, and we saw a drop in the 65 to 84 category, though we saw a little increase in those that are hospitalized that are over the age of 85 and above. So we keep that looking at. The governor earlier today said that I believe 63% of all people that are hospitalized did not come from a nursing home setting. That does not totally surprise me when you look at this data here, which shows it's a little less than 50% of individuals that are under the age of 64. Almost every single one of those individuals, except for a very few, are coming from a house. Very few are coming from a nursing home. And the same thing with the 65 to 84 category. Not all those individuals are coming from a nursing home. So there's a majority of individuals in Erie County that actually are coming from a home, their house, their apartment, not a nursing home, to hospitals. So I think it's very important for the public to understand that we're glad to see the hospitalization numbers go down, but it just doesn't mean that it's people in a nursing home that are getting sick. It's more, we believe, individuals that living in their own house that have to be hospitalized, and those just coming straight from a nursing home. Now, of course, this is an important chart we've shown, which is admissions versus discharges. And what we really are looking at is to see that red bar exceed the blue bar, which it did. Discharges exceeded the admissions by 15 patients on May 4th. I think it's pretty noticeable there. New York State is seeking a 3-day rolling average of less than 2 new hospital admissions per 100,000 residents. We have 920,000 residents, so you got to take that and look a little bit on 18 or above on an average day. And we are currently meeting that metric. We're about 1.25 now, so you want to be less than 2, and we're at 1.25. So this is another metric that we're very happy that we seem to be meeting. You do notice that one day, April 27th, the blue bar is shooting to the roof. We had one bad day, really. Otherwise, our admissions and discharges, we've generally held our own in that, except for that one day. So I think that's why it's very important to look at rolling averages, not just a one-day figure. But I am glad to see that the discharges significantly exceeded new hospitalizations. And new hospitalizations, as you can see, are going down from where they were just a little over a week ago. Mortality data. This is information, of course, based on age range. We really want to know who is dying as a percentage of the by age to give us an idea where it's coming from. And as you can see, 52% of all deaths are individuals 80 and older. And if you look on the right-hand column, at least as I'm looking at it, right-hand column, you will see that 4.8% of the population are individuals 80 and older. So they are making up a disproportionate share of deaths as compared to the individuals that they actually make up in the population. So this is, as we've said all along, COVID-19 is very, very serious for an individual basically over the age of 60, but especially 70 and above. Because that's where the vast majority of our deaths have come from. About 75%, excuse me, have come from the 70 and older category. And so we certainly remind everybody that we're wearing masks and we're taking measures as we are, not only to protect ourselves, but to protect others, including loved ones, especially when they have to go shopping, when they have to go to the store. So continue to follow the good, proper social distancing guidelines so we can protect other people, not just ourselves. Mortality data based on Gender, and you'll see, which is something that's a little interesting, is that while males make up a majority of the deaths, when it comes to those that are 80 and above, a majority are actually females. I'm not exactly certain if that's because they generally they live longer. We talked about this data in the past, but it is definitely striking those that are over the age of 80 significantly, and a majority of those over the age of 80 are females who unfortunately are passing. Mortality data based on ethnicity and race. This African American number with regards to percentage of the population of those who are deceased continues to drop from where it was. African Americans make up about 15% of the population, and right now it's a little less than 19% of all deaths. We were very worried at first when that number was showing about 33% of all deaths, but it is now falling more in line with the actual death ratio, or I should say the population ratio. We don't want to see any deaths, but I'm glad to see that we're not seeing an inordinate amount of deaths among people of color, which unfortunately many other communities are seeing, and downstate, in New York City especially, people of color are making up the vast majority of deaths. So we are not seeing that here, which I think means we're doing a pretty good job of addressing this in communities where people of color live. And then, of course, Hispanics or Latinos, it's been trending at about 2% of fatalities, even though Latinos make up over 5% of the population, so that is a little lower than what it normally would be. The New York State requirements for opening, you've probably seen this many times in the last 24 hours since Governor Cuomo released it. This is the important chart that shows the key metrics that we have to meet. The first metric with regards to 14-day decline in hospitalizations, and we are starting to trend in that direction, where I'm hopeful if this current trend of hospitalizations continues, that red will go to green. That's very important that it happens, because it's only in the capital region in Western New York where we have that red instead of the green. So we want to continue to see a 14-day decline in hospitalizations, or the 3-day rolling average. The other ones, we're very close on the new hospitalizations. As I noted, under our most recent 3-day average, we're actually below 2. So I feel confident that we'll be able to meet that if we keep up our hospitalizations very soon. So those first two red columns you see in the Western New York block there, I feel confident that we should be able to meet those very soon. The testing is a big issue. We are not yet at the position where we can do the testing. We are ramping up testing. We believe we're about 300 tests a day short of where we need to be. Now, this is a combination of tests that we can deliver plus tests that are being administered, so we need people to actually do the tests. And this is not antibody testing. This is the traditional PCR test, the nasal test with the swab that's put up your nose, as well as also they often will take a swab from your throat. So we need people to take those tests, and we'll talk about a little bit more about that later in testing, but people do need to take advantage of the tests that we offer if you believe that you've been exposed, so that we can meet the standard. We believe we can meet the standard working with our partners. We just need people to test. And then contact tracers, I'll talk a little bit more about contact tracers. We're not where the state wants us to be, but we believe we can get there, and we have a plan to get there, and I'll talk a little bit more about that in a second. And in regards to a response to address these, first off, new testing update. With regards to the Erie County Department of Health's public drive-in testing clinic, we are now opening it up to any individual who believes they've been exposed to COVID-19, or if you're at risk for COVID-19 because of your occupation, or you live with someone who may have been exposed, but you have not yourself shown any symptoms. So you no longer have to be symptomatic. You can be asymptomatic. You don't have to have any symptoms to test if you believe you have been exposed to COVID-19 or you're at risk for COVID-19. You call 858-2929 to make an appointment. You do not have to have a doctor. Here is some of the protocols associated with this. This is the traditional test. This is not the antibody test. So this will determine if you have the coronavirus in your system at the moment of the test. It is not the antibody test. So if you felt like you may have been sick in early March, but you've been feeling great lately and you don't have any reason to believe that you would have been exposed, then this test probably isn't going to be for you. But if you meet that category of you're at risk or you believe you may have been exposed and you could be an asymptomatic carrier, you qualify. Who is subject to the commissioner's isolation orders? We've changed the isolation orders. If you are not showing any symptoms, you do not need to isolate. If you are showing symptoms, you must isolate until you get your results. So if you're sick and you get the traditional test, the nasal swab, and you're waiting for the results, if you're sick, you may have COVID-19, and there's a chance, based on what we've seen, about 20% chance that you have COVID-19, so you have to isolate. If you do not have symptoms, if you are asymptomatic, you do not have to isolate, but you have to monitor your symptoms. And if you develop symptoms between the time you get tested to the time you receive your results, you have to isolate. That means no work if you are working right now. It means doesn't going out in public. You have to isolate yourself from the general public, and it also means you got to isolate yourself from the people in your home. And you should contact your doctor if you have one, if you develop the symptoms. So that is the new testing protocols and standards with regards to the Erie County Department of Health. And just going back a slide, once again, you call 858-2929, following the instructions that you listen to, and you can set up an appointment for a test. The Kaleida Health also has a testing site at the Leroy Coles Junior Library on East Delavan. It is open from Monday, Wednesday, Friday for individuals with COVID-19 symptoms by appointment only and a prescription, a referral from your primary care provider. You can contact Kaleida Health. The web page, I should say, the link is on there. They also have a phone number that you can call. And then New York State has a Department of Health testing site, which is also available for any individual that is part of a high-risk population. This was at one point for symptomatic individuals. It's now asymptomatic individuals. So you don't have to have any symptoms. And that includes close contact with a positive case, you're a healthcare worker, nursing home employee, first responder. If you qualify, if you meet that, you don't even have to have a symptom. You can get tested. You call 888-364-3065 to sign up for the testing at the Cobblestone Perry Street site. Now, I want to bring something up that is concerning to all of us. As I noted earlier, to meet the governor's standard, we have to meet a certain level of testing. There are open spots in all of these testing facilities. We have openings in the county's facility, we have openings at the Kaleida Health's facility, and we know there have been openings available at the Perry Street Cobblestone District New York State Health Testing Facility. The only way we're going to get up there is to do additional testing. So we're considering also advancing testing with our employers to test their employees so that we can meet the standard that the governor shows with regards to tests. It would be terrible after having early on hardly any tests and people wanting to be tested. Now we have lots of tests and we don't have people to test. So we want people to get tested. And then there's antibody testing. This is not a diagnostic test. This will not tell you if you actually have the coronavirus at this moment. It will just tell you if you were exposed and you have antibodies. It is not part of the New York State analysis for reopening. So if hundreds of thousands of people got tested for antibodies and no one was doing the PCR test anymore, it still wouldn't matter. It is not part of the analysis for New York State. It doesn't involve a blood draw, finger stick. I heard a couple people fainted at the county's internal testing for some of our employees. If you're going to get this done, you have to understand it is a blood draw. So a lot of people aren't really too thrilled with that, but that is how the antibody testing is done. There are some healthcare providers that are providing it. And as you can see, this was updated and we'll do it on a weekly basis. As of May 2nd, all tests that were received, a little over 8,000, 8.3% of those who had been tested came back positive. So we're less than 10%. That means the vast majority of us, 90% plus, have not been exposed. Now, Erie County has a plan to offer antibody testing to up to 100,000 right now. We have been doing tests to Erie County employees, including our first responders on the COVID response and others that are working. We are refining our scheduling, testing, and the reporting process so before we can open it up to the general public. Now, the initial results of the employees, the initial 500 or so that were tested, had exceptionally low positive cases. So the individuals who were tested, and I don't know who tested positive, but they're going to be receiving in the mail in the next 24 hours a letter from Erie County indicating whether they were positive or negative. What we are seeing, and it's a good sign, that of the hundreds we tested in the first round, 99 to 98% of them tested negative, which means we've done a great job of preventing the coronavirus from being spread. And we do know that a number of the individuals who took the antibody test in the first round were positive because they had been previously tested for the coronavirus. So the vast majority of individuals who took the test were negative. And we will announce the schedule and locations as soon as we feel confident that we can handle what we know will be crush of calls to receive the antibody testing. And we need to get at least a full 2-week supply of antibody testing from Abbott Labs before we will move forward with that, and we right now do not have a full 2 weeks. Contact tracing, big role that is a metric that needs to be in place for the governor's reopening indicators. We have been contact tracing throughout the entire crisis. There are approximately 20 contact tracers that work for the Erie County Department of Health. And I assume they're probably working right now calling the newest individuals who tested positive in the most recent tests. New York State is requiring 30 contact tracers for every 100,000 residents. We have a little less than 4,000 cases. Our contact tracers contact the individuals that are positive to determine who they were in contact, the close contacts. We can handle the caseload right now, but we do need to meet the governor's standard. So I have authorized our Department of Personnel to work with various departments to increase contact tracers to meet New York State standard using current employees. So we do not have to do new hires. We may bring back some people who are currently at home not working, but we are going to increase our contact tracers. We've heard New York State may be offering contact tracers. We don't have any idea when that's going to happen. The governor said it's going to happen, but talking to the governor's staff, they don't know when they'll be ready to do that. I'm not waiting. I want to make certain Erie County can meet that metric, and we're one of the first counties to meet that metric. And I also hopefully will be talking in the next 24 to 48 hours with my partners in our Western New York Regional Economic Development Council counties. That includes Niagara, Chautauqua, Cattaraugus, and Allegheny. Wyoming, Genesee, and Orleans are in the Rochester area. But I want to talk to those leaders about what they're doing to ensure they're ramping up contact tracing, because I'm not going to allow it on my watch that we're unable to reopen as quickly as we can because we don't meet the contact tracers. We're going to do what we can to meet the contact tracers. A couple remaining slides on the business task force. Of course, we talked about the Erie Grown to help our local farm community and help you get fresh produce and other goods straight from the farmers in our region. Go to erie.gov/Erie Grown. It's a resource hub for everyone. Something that I find a little interesting with all the issues out there regarding businesses in need, the Erie County Industrial Development Agency has an emergency business relief program and loans. We've had very few inquiries from local businesses. Less than 70 in total have inquired with regards to the programs that we have, and less than 10 have actually applied for assistance. So if you are a business owner, I don't know what's wrong with the phone, the number there. That should be 716-856-6525. So that's 856-6525. I don't know where the 817 area code goes, but don't type in 817. Type in 716-856-6525 to talk to someone from the Erie County Industrial Development Agency. And of course, there also is a web page, a special web page with the assistance that they provide. And then finally, the SBA. We know that there's small businesses that are still applying for the SBA loan programs. You can call the local office at 551-4301, and they'll be able to help you. So that's actually in our 716 area code, not the 817, wherever that might be. Got to fix that little typo there. But it wouldn't be live TV if it didn't have a typo every now and then, or a mistake. And then finally, nurses. Thank you, nurses. Thank you, thank you, thank you, thank you, thank you to all the nurses out there. Once again, thank you, thank you, thank you, thank you, thank you. And with that, we'll open it up to the questions from the media. And we'll start, I believe, last time we started on the bottom. So this time I will start on the top. Is there anyone there from WKBW TV? Hearing none, we'll move on to Channel 4. Kelsey Anderson.
Yeah, Dan Telbach is actually on the line. He has a question first. I'll let him go.
Sure.
Hey, Mark.
Hi, Dan.
Dan Telbach, Channel 4. I'm asking a question about the inspection of septic tanks and private wells. The county is telling people that they'll allow these private companies to do it, but the county has suspended suspended inspections of septic tanks. Can you elaborate on the reasoning for that?
We don't have the
private
staff.
company can go out and-
We don't have the staff.
Huh?
We don't have the staff.
What do you mean?
The people who are doing inspections are involved in the COVID-19 response.
Okay, so they're really, I mean, you've got a backlog of 500 people, and the average amount that they have to put in escrow is $12,000. That's $6 million.
I'm going to have to turn that over. You're going to have to turn that over to Dr. Burstein because it's we have
Okay.
individuals. Our rodent control is working in the warehouse with regards to PPE distribution. The individuals that are contact tracing, we don't have contact tracers that just work. It's not like we have a job that says contact tracers. These are individuals from the Department of Health. They're sanitarians. That is the explanation that I've received from Dr. Burstein, and that's our Department of Health is exceptionally busy, and they're doing the COVID-19 response.
Is she not there today?
She's always off on Wednesdays.
Oh, okay. All right. So
Next, we're going to move on now. We'll move on. You only get one question at this round. Jeff Preval from WGRZ.
Yeah, thank you, County Executive. Could you maybe just assess at this point, I know everyone has their eye on May 15th, but, you know, does your gut give you the sense that that is a realistic date for Erie County or Western New York to start opening up? Or do you foresee end of May? What's the projections at this point?
Well, based on the governor's own metrics, with only 3 of the 7 having been met as of yesterday, it's highly doubtful we'll meet May 15th. It's possible. Remember, they're looking at 2-week rolling averages. So if the next, what day is it? The 6th? Okay, if the next 9 days is that much better with regards to these hospitalization and contraction numbers, then we'd have a shot. I am working very hard to meet the things that we can do on our end with regards to contact tracers and ramping up the testing. But there are things that are out of our control in county government, and it often has to do with hospitalizations and deaths. I said a couple days ago that I thought we'd have a much better chance of opening by June 1st. I'm hopeful we meet the May 15th deadline, but right now I don't think we're there yet. And if any place did open up on May 15th, it would probably be the North Country, Southern Tier, and maybe the Mohawk Valley. Spectrum News, Aaron?
Yeah, just wanted to get your reaction. Catholic Health has been approved to start up elective surgeries, and I know Kaleida and ECMC are applying for that waiver too now.
Yes, that's a very good sign. I talked to Mark Sullivan, the CEO of Catholic Health earlier today. Actually, I was going to say that in my presentation and forgot. See, if you don't put a slide in, sometimes you forget about it. But it's a good sign. It means that we have sufficient bed capacity with regards to total beds as well as ICU beds to start electives. They're not going to start every elective, but they will have the opportunity to do that. According to Mark Sullivan, they believe they will open electives starting in the surgeries on Monday. I was texting back and forth with Jody LeMayo of Kaleida, as well as Tom Quattrochi with ECMC. They both have applications in for waivers and are hopeful that they'll be able to do electives soon too. But this is a very good sign. And it's one of the reasons why over a week ago I said I thought we could do electives, because we had at least 2 to 3 weeks of data which showed our numbers with regards to hospitalizations were such that we had excess capacity on beds and ICU units. And I'm very happy to see that New York State Department of Health authorized Catholic Health to perform those elective surgeries. Buffalo News, Sandy Tan. Sandra?
Yes, hi, thanks, Mark. Just one thing I'd like to clarify. You had said that there were 3,923 confirmed COVID-19 cases, but your COVID-19 tracker was 3,939, which is higher. I just want to figure out which one is the correct number. In addition,
I would go with the tracker. As I say at the beginning of my press conference, the information can change, and they may have provided more information in the meantime.
Okay. What is your level of confidence in being able to meet the hospitalization benchmark? I know right now you're really trying to encourage as many people as possible to get tested. which is a big leap forward for the county compared to when you had very few tests available. Right now, the county still doesn't even meet the per capita testing that Monroe County has had or other upstate counties. But
Well, no regions actually meet except for New York State or New York City. None of the upstate regions meet the testing requirements, is my understanding. The hospitalization is out of my control, other than telling people to stay home and follow proper social distancing guidelines. Go out only when you need to. If you go out in public, wear a mask. If you're going to go do your gardening by yourself, you don't need a mask. If you're going to do gardening by yourself and your spouse that you live with, you don't need a mask. But if you're going to go to a supermarket, you need a mask. If you're going to go to a store like Target, you need a mask. If you're going to go to pick up food, and I pick up food when I'm heading out sometimes, I wear my mask. And so that's what we're asking, is for people to do that, because you're protecting yourself and you're also protecting someone else in case you're an asymptomatic transmitter. So someone may not have any illness, not be showing that they're sick, but they could be shedding the disease. And we're very fearful that that's how we're going to see additional community spread, is that people aren't taking it seriously, thinking, oh, I'm not sick, I'm healthy, I don't need to do that. And then they transmit it to someone else. So we can't control it. All I control is the contact tracing and trying to ramp up the testing numbers. But we can control it as a community by ensuring we do the right thing so our hospitalization numbers continue to go down.
I think I was referring specifically to testing. In terms of your level of confidence that you're going to be able to meet the testing benchmark.
As long as people come to get tested, I think we can meet it. It may take us another week or so. We have to ramp up with another approximately 300 tests per day, but our health department, in talking over with hospitals and others that are doing testing, because there's so many entities that are doing testing now, we think we can meet it, but you got to have the people to be tested. That's what we're worried about, and we're trying to get further information from New York State as to whether or not we, if we have the capability but no one's showing up for testing, what does that mean? And that's a fear, is that people are thinking, oh, I don't need to be tested, I'm healthy. Well, then that's a concern that we'd never be able to meet the standard. So I feel confident that within the next short period of time, at least in the next 2 weeks, we'll meet that 300 extra per day that we need to, as long as we have people to test.
Okay, thanks.
Mike Mroziak, WBFO.
Good afternoon, Mark. We're already starting to see summertime events canceled, like the concerts at Canal Side, the Allentown Art Festival. As per what I read in the Buffalo News, you're not liking the odds of any kind of local sports this summer. How soon before you think we might be able to safely have some of these sport and cultural events here in Erie County?
They are all in phase 4 of the governor's plan. And remember, if you get to phase 1, you got to at least have 2 weeks worth of data to show you can go to phase 2, that you haven't had an increase in your hospitalization. So let's assume we were able to go to phase 1 on May 15th. The pause order was ended. We are in phase 1. The earliest we could even think about going to phase 2 would be the first week of June. And then we'd have to have another 2 weeks of data to show that it's time to go to phase 3. So now we're talking about the mid-June, and in phase 4, we're talking sometime in July. I've had some questions with regards to youth sports, and youth sports fall under the recreation category, which is phase 4. If everything went well, we go from phase to phase every 2 weeks. If it didn't go well, we would not move on to the next phase until we could show we can handle the new caseload, so to speak, in both the hospitals and otherwise. I've got a lot of parents who are like, please open up youth sports. I don't make that call. That's part of the phase 4 in the recreation, as well as the arts and culturals, those types of events. And for that matter, sporting events where the public is going to attend. I know Bills tickets, the season is being announced. And unfortunately, a lot of people are saying, hey, am I going to be able to go to the Bills games in the fall? And the answer is, I don't know. When I practiced law, and I had a client and they were being deposed or going to be on the witness stand, I used to tell them, I don't know is a legitimate answer if you don't know the answer to the question. And with regards to what will happen later this summer, I don't know. I'm hopeful we meet our benchmarks as quickly as possible, but even if we do, recreation is in phase 4, which means it's probably not even going to be considered until early July. WBEN, Mike Baggerman. Are you there, Michael?
Yes. I guess I want a little bit more context to something that you brought up earlier in your presentation today, and that's about an asymptomatic person who gets a test, but they don't have to isolate while they await their results. I guess what's the rationale behind that? Because can't they spread the disease even if they're asymptomatic?
Yes, but the problem is many of these individuals work in settings where we cannot have them be isolated, like nursing homes or hospitals. So if a nursing home was tested and every single individual of the staff who was tested then had to isolate for 2 weeks or till they got their result, a week, there'd be no staff for the nursing home. We also believe that to meet the testing guidelines that the governor has required, this that we're just talking about with Sandra, we have to start testing asymptomatic individuals, not just testing symptomatic individuals. If we were to test solely symptomatic individuals, we'd probably never meet the governor's guideline. So what we want to do, if people don't have any symptoms, but you feel like, well, maybe I'm going to get tested because I may have been exposed because of where I work. We want people to come and get tested. We do not want them to stop and say, I'm not going to get tested because I'm afraid of being isolated and I don't have any symptoms. So the idea is it gets us an opportunity to test people who are in situations where we want them to be tested to see if they are positive. And if they are positive, then they have to go in isolation. If they're not, then they know they're clear. It was a discussion that our Department of Health had with the New York State Department of Health, but everyone felt it was in the best interest of protecting the community that we tested as many people as quickly as possible, especially asymptomatic individuals who work in a more difficult environment, one that potentially puts them at risk of exposure. Anybody else that I have not called on through this first round? If not, we'll go back to Channel 7. Anyone there? Not Channel 4. Kelsey Anderson, Dan Telvach.
It's Kelsey. I was wondering if you have any update on campgrounds. You know, you submitted that revised order last week. Have you gotten any update on that?
Our legal department is working with the state's legal department. There seems to be some questioning going on. I have not gotten a final order from New York State. So we're going to try to resolve it by the end of this week. I think the state might be taking some action with regards to campgrounds. But right now, we have not gotten a final order. If they refuse to accept it, then there's no more order. But there seems to be some back and forth going on, including if the state's going to take some actions with regards to camping facilities. I have put forth to the state a proposal that anyone who has a permanent like campsite where they're parking an RV that has its own, or it could be a temporary campsite, but it has to have its own bathroom facility included within, so you're not using shared bathrooms that are on a campgrounds. Those could be allowed. But there's some back and forth right now between the state and the county with regards to what is appropriate or not. We're not the only county to have done this. Excuse me. I know Greene County in upstate New York also did it. I know in Pennsylvania they had a complete ban on all camping throughout the whole state. So it's not like Erie County is the only one that's done this. And truthfully, there are very few, if any, campgrounds that were open until basically now. Our goal is to get this all resolved very soon, so when people are questioning what they can do as we move forward with the warmer months, they know what the answer to that question is. Considering they're talking about snow in the forecast, I don't think it's really a great time to go camping, at least tent camping. Jeff Preval?
One more.
Or is that, who is that? Is that Dan? Okay, Dan.
Yeah, one more. Mark, why should these folks have millions of dollars locked up in escrow if the county is not willing to come up with some kind of solution? Is it working on a solution behind the scenes?
My understanding is they have been working on a solution, and that's in at the health department's bailiwick, so to speak. I've got 30 departments, many different divisions. I don't know what's going on at any one moment in all the departments and divisions. And to tell you the truth, except for the direct health department response or the health response to COVID-19 and the economic response, I have not been actively involved in almost anything else in county government. My time has been spent almost 100% on response to COVID-19 from a health and emergency services point of view, acquiring PPEs, as well as the economic response with our economic task force. So I really, you best directed that question to the health department to answer the current status of it. I'm sorry.
Okay, Mark, thank you.
Channel 2, Jeff Preval. Jeff, are you still there? If not, Aaron from Spectrum, do you have any more questions?
Mark, can you hear me?
Yes. Go ahead, Jeff.
Mark, this is Jeff with Channel 2. Sorry, just playing with the mute button here. But could I just clarify something that you may have said earlier in terms of trying to boost testing? Are you looking to try to get testing done through employers or with employers? I just wasn't really clear on that, and I just wanted to see how that was going to work out.
We're looking at that as an option, including some of the larger employers that may be reopening to meet the standards under Phase 1 for manufacturing. We think that is going to be needed in some locations where they may have had individuals who tested positive for COVID-19 in the past. So we are looking at that. Right now, if you call the 858-2929 number, you can qualify for testing even if you're asymptomatic without a test. So anyone can do it, doesn't matter regarding employers, but we are considering expanding and offering testing to some of the larger employers that have a worry with regards to personnel and the contact that they may have together. We are putting a plan together for that right now, but it's not set in stone. So right now the testing is just available for anyone. You don't have to be associated with a particular employer.
Okay, but which employers would you be including in that?
That's part of the plan we're working on right now. I guess the thing I would just add to that is if you are an employer and you have employees that you feel should be tested, you can always have them contact and set up the test through the 858-2929 number. Michael Mroziak, do you have any more questions?
Yeah, just a follow up to reopening culturals and recreation under Phase 4. Let's say it's a professional entity like minor league baseball. There's been talk of the majors trying to get going in June. If minor league baseball wants to resume play in a period when it might not quite be ready in Erie County, who would have the final say to tell the Bisons yes or no? Would it be the state, the county? Who would have the final say?
We're still waiting for further guidance as to the actual players and the team and their staff. I would be under the assumption that even if they did open, there'd be no fans in the crowd. That's that recreation Phase 4 activities. We're still waiting for final guidance as to whether or not they theoretically could open earlier if it's just the teams playing, as long as they meet proper social distancing guidelines. I mean, there's some sports where it's a little easier to do that than probably others. Baseball is probably a sport where it's easier to do that just because of them being spaced out in the field and what they can do to space out the players in the dugouts. It's not so easy for football. Certainly not so easy for hockey. I'm a hockey player myself. You're a hockey player, Michael. You know how hockey is, how close you get on the bench. You're breathing heavy, so there's concerns there. But it's something that we're waiting for further guidance from New York State on. Sandy?
Okay, thank you.
You're welcome. Sandy, do you have any more questions?
Yes, we noticed that there has been a big leap in confirmed COVID-19 cases in the town of Aurora over the past week, and we're wondering why that is. Is that due to increased testing in nursing homes, and if that's the case, any in particular?
It is my understanding it is directly attributable to increased testing in nursing homes. I don't want to say the name of a particular nursing home because I don't know how many nursing homes there are in the town of Aurora, village of East Aurora, but I have been advised, and I advised Supervisor Jim Bach, who reached out to me from the town of Aurora, that the increase for the town of Aurora is directly attributable to positive cases in nursing homes.
Okay, right, thank you.
You're welcome. Last question, then we'll go to Mike Baggerman, WBEN.
Hey, Mark. Baseball can be a contact sport. I just want to make that totally
well,
clear.
It could be. They certainly changed the rules with regards to crashing into home plate.
Mark, my question for you is just talking about county finances. Now, we talked about cuts in Erie County across the board in all departments. Do you know if this is going to also apply to salaries for all people who work for the county?
We're looking at all aspects of it. I would prefer not to do layoffs. That's why I'm focusing on trying to get additional assistance from the federal government. We received some guidance in the last 24 hours regarding the CARES Act funding we received, $160 million. We cannot use it to plug holes, but we can use it to basically pay for all costs associated with COVID-19, including individuals who are currently working. So I feel that that's going to be helpful, but we're still going to be facing a significant shortfall, and that's why I'm really focused, like I was earlier today with County Executive Molinaro and Steve Aquario from NISAC in our statewide conference call with media, that we really do need a stimulus package 4.0. If we get that, that'll certainly alleviate a lot of the concerns that I have. There's talk that that package might even be a 2 or 3 year package to help offset what will be losses in future years. I really hope that's the case. I have no interest in laying off any employee. I have no interest in furloughing any employee. I know union leaders I've talked to have no interest in layoffs or furloughs, but they also understand that we cannot pay for services that we don't have money for. So while everything's on the table, I'm working very hard, working the phones with regards to talking to our federal representatives, Congressman Higgins, Senator Schumer, Senator Gillibrand I'll be talking with very soon, and supporting their efforts to ensure that the front lines, which is local governments, get assistance to get us through this very difficult time, which we then have no choice of cutting people. And I remind everybody that we have to provide certain services under the law, so if we can't provide them, we have to find a way to pay for them. And that's going to be very difficult in today's situation. Okay, with that, I think we've done 2 rounds of questioning. I want to thank our members of the media for participating in this latest COVID-19 outbreak media briefing, as well as a YouTube presentation, which was live on our YouTube station for Erie County. I want to thank everybody for the work that they've done to continue to see that those hospital numbers go down. I'm going to go back to that screen just to once again show the latest 2 weeks. So if they could put that up on the screen. This is the direction we want to head. We want to continue heading downwards. We want to see hospital numbers for all beds that are COVID-19 patients go down. We want to continue to see ICU beds go down. We want to continue to see ICU intubations go down. I don't like seeing that purple line on the bottom going up because that's deaths in hospitals. We want to see that go down. So if people follow the appropriate guidelines, we will get through this, and we'll probably open up sooner rather than later. It's as simple as that. We are in some ways at the mercy of the data, and the data does not lie. The data tells us what's happening in the hospitals. The data tells us what's happening with regards to the contraction of the coronavirus across the community. So if we all do the right thing and we continue to see that these numbers go down, we'll be all better for it. Until I talk to you again, may you be safe. Happy National Nurses Day to all our nurses out there. Thank you for all that you do. Thank you to Kendra from Deaf Access Services, who's been working a lot harder than I am in the corner there, providing the American Sign Language. And to all, be safe and be well. Thank you.